My name is Dr. Sanusi. I'm a Senior Registrar in the University College Hospital Ibadan. Each part of the body contains small structures that we call cells. There's a way those cells can grow, die, and they maintain a normal structure, the way it has been created. But when those cells start to grow abnormally without any control, then the patient has had what we call cancer. There are different types of cancer. As I said, cancer can affect all the parts of the body. For men, those common cancers include the prostate cancer, lung cancer, skin cancer, we have blood cancer, colon cancer. Those are the ones that are very common in men. Generally speaking, some cancers, especially in men, are more common in certain age group as well as even the race. For instance, I just said now that prostate cancer is common in men. So as a man gets older, the risk of having prostate cancer increases. Anyone that is above the age of 40 has increased risk of having cancer. Those that are 60 years and above are even more at higher risk of having prostate cancer. Now, in blacks, this prostate cancer is very common in black than in the whites. Then, if someone asks the family who has had prostate cancer before, the chance of that person developing prostate cancer is higher than someone who has no family with prostate cancer. Another cancer that is very common in those who smoke a lot is lung cancer. In fact, lung cancer is the common cause of cancer-related death in men. So those who smoke a lot have increased risk of having lung cancer compared to those who do not smoke. That doesn't mean that someone who do not smoke cannot develop lung cancer. Just that the fact that they are exposed to that smoking increase their own risk of having lung cancer. Okay, thank you. So generally we know that we may not be able to say this is the actual cause of cancer. We know the risk factors for different types of cancer. Therefore, measures can be taken to reduce this risk. For example, the risk of developing lung cancer increases with smoking. So we counsel people to stop smoking. And if you have people around you who smoke, it is good that counsel them to stop smoking, because a second-hand smoker is also at risk, just as someone who is the first-hand smoker. So stop smoking. That is an important measure in reducing the risk of developing lung cancer. Now, for prostate cancer, now we know someone, as you increase at your age, the risk of developing prostate cancer increase. So when you are 40 years and above, there are screening methods that can be used to detect early if someone is developing prostate cancer. One of those measures is, one, you go to the hospital for clinical examination. Urologist will examine you, the doctor will examine you, check the prostate to feel the texture. Is it normal texture? Is it getting hard? We ask questions. Are you having symptoms of prostate cancer, like having difficulty urinating too frequently, waking up in the night to urinate, or even urinating blood? So when you are having all those symptoms, it is good to present in the hospital for clinical examination, where the prostate is examined and we'll see if there is any change in the structure. Another screening test for prostate cancer is what we call prostate-specific antigen. People who are more than 40 years should go for this screening test. So there are normal values that a man should have. We know that with increase in age, the value keeps increasing. But when you have a very high value, that's a pointer that someone has the risk of developing prostate cancer. Another examination that we do is they can request for an ultrasound, or some people do CT to look at how the prostate is and the surrounding structures. Is it normal in size? Is it normal in shape? Is it normal in volume? Is it normal in structure? Or are there abnormal structures that if it's increasing in size or the cancer is already spreading to different parts of the body? Some of the warning signs of prostate cancer include hematuria, when someone urinates with blood. This is a warning sign, though there are other things apart from prostate cancer that can cause hematuria. The other ones include hesitancy, getting to where to urinate, and you have to wait for minutes before the urine comes out. Some people have what we call terminal dribbling. After urinating, you still see urine coming out. Some people have frequency, they urinate too frequently than normal. Some have dysuria, that is painful urinate, they have pain when they urinate. Some have nocturia, that having to wake up several times in the evening to urinate. Some people may even have difficulty passing urine. The urine, when you get to where you want to urinate, the urine doesn't come out at all. So these are the common symptoms for someone with prostate cancer. For lung cancer, the common symptoms include cough. When you start having chronic cough, someone who is coughing for 2, 3, 4 months, this could be a warning sign for lung cancer. Or when we cough and the sputum that is produced is stained with blood, that is a warning sign. A man with lung cancer can have chest pain, difficulty with breathing. Also, depending on different parts of the body the cancer has spread to, there can be very, you can have bone pain. You can have, they can even be convulsing, having recurrent headache. The eye can be yellow, the urine can be yellow if it has spread to the liver. These are different signs that someone with lung cancer can have. But more importantly, is cough productive of bloody sputum, chest pain, and difficulty with breathing. Getting the diagnosis of cancer could be psychological to a man. Everybody has a plan as to what to achieve in the next 1 year, 10 years, 20 years. But having that diagnosis gives one the belief that this is the end of life, although that is not usually the case. So diagnosis of cancer causes a lot of emotional trauma on the patient. And the cause of this include: 1, having the belief that one's life will be cut short. 2, the belief that it will drain the purse of the family, because the diagnosis will mean that you have a lot of investigations to carry out to know what the state of your health is. You need to spend a lot of money on the treatment, and the surgery, the drugs, the radiotherapy. So all this can cause a lot of trauma on the man as well as the family. We have a lot of specialists in Nigeria who can handle different forms of cancer in men. The common cancers that we have in men. We have urologists in Nigeria who can handle prostate cancer. We have the general surgeons who can handle the colonic cancers. We have the cardiothoracic surgeons, though we have paucity of that, but we still have them in Nigeria. Those are the ones who can handle lung cancer in conjunction with the cardiologist as well as the pulmonologist and the anesthetist. For radiotherapy, we have radiotherapists in Nigeria, although we don't have them all over the country, but there are specific teaching hospitals in Nigeria that have radiotherapists. Example, in the University College Hospital, they have radiotherapy units. In the LUT, they have their radiotherapy unit, and I think they have a radiotherapy unit in the northern part of the country as well. But with the advent of Japa syndrome, a lot of specialists are already leaving the country. So, and this will have a negative effect on the care of cancer survivors. So my advice to the government would be that you put a lot of incentives in place which can retain our best brains from traveling abroad. This will go a long way in helping our cancer survivors. So a lot of advances are being made in surgical techniques to improve the safety of the surgery as well as the outcome of the patient. Newer drugs are coming on board so as to reduce the side effects associated with the older drugs, and this comes with a better compliance with treatment. Immunotherapy and hormonal therapy, those are newer drugs coming on board to help in the treatment of cancer patients. The downside of this is that the newer treatment techniques are actually more expensive than the older ones, and that is why we need government to actually help cancer patients with funds. NHIS, yes, that's one of those places where the government has come in, but they need to also expand the scope of the NHIS such that cancer patients are also captured. This will improve the outcome a lot of to a long extent. Another aspect is the non-governmental organization coming on board. I understand that there are some NGOs who are strictly for cancer treatment, so they give a lot of funds to the hospitals where these patients are managed, and this has been a lot of succor to the patients. My name again is Dr. Akeshola Tesleem Sanusi. Kindly like, follow, and subscribe to Orion Cancer Care Foundation.